again, welcome to Congress. I am from Turkey and my subject is determining the effectiveness of training and follow-up program given to patient with pacemaker. Heart rhythm disorder except bicycle rhythms are called arrhythmias. Pacemaker are implantable device used in treatment of arrhythmias, especially bradyarrhythmias. This is a picture of pacemaker. As you've seen, here is some cable and for power generator. And this is in human body. Clinical studies have shown that pacemaker can extend the patient's life as well as fixes the symptoms of expansive bradycardia, for example, vertigo, shortness of breath, feeling faint, exercise intolerance, lack of energy, and increases the quality of life, improves exercise capacity. On the other hand, in spite of benefits, pacemaker implantation can cause also the challenge of living with a foreign object placed in the human body for patient. For 1 minute, please imagine you had a pacemaker in your head, and if you had a pacemaker, what would you feel? Is it easy to live with pacemaker? I mean, for again device in your body or not? And the presence for a foreign object in body can lead to change in body image, adverse effect in physical adaptation and mood disorders. Clinicians often focus on the technical aspect of device function and is able to ignore the psychosocial effects on patients with pacemaker. Plan and training given to patients with pacemaker and follow-up is important to live compatible with device and improve quality of life for patient. Plan training given to patient help to control fears related to living a mentional device. This research is an intervention study to evaluate the effectiveness of planned education and follow-up program on quality of life, anxiety and depression levels of patients with pacemakers. Method, the research sample consists of 6 patients, 30 in intervention group and others control group. Patients implanted with pacemaker that meet the study criteria followed at Ankara University and another hospital. Non-probability sampling method was selected as the research sample. Data was collected with patient identifier, data collection form, Schippelberger study, trait anxiety intervention and back depression inventory and SF-36 quality of life, health related. These scales were applied to patients at the beginning of the study and then again after 2 months. In the first interview with patient in the intervention group, individual interviews were carried to identify education requirements. Individual education was given on the related subjects and second meeting was circulated for 2 months later. A phone number was given to the patients and their relatives to reach the researcher during this time. Patients and their relatives received counseling from the researcher via phone in between the interviews. The normal clinical procedure continued for the control groups. This group was also given education at the end of the research for ethical. And the result, this table 1 and said us comparison of mean depression score in the follow-up of patient in the intervention and control groups before and after intervention. As you see in intervention group, depression score is reduced after planned training and follow-up, and it is significantly important. And table 2, it is related to anxiety trait, as you seen in intervention group, anxiety level getting low and other anxiety state scores. Again, there is a difference before and after. And this is about quality of life scala. It has got lots of sub-scala. The most important general health perspective. Between before and after in intervention group, there is important difference. Yes, discussion. After score of state anxiety intervention group were decreased statistically significant, but there was no difference in control group, as we see on the table. After planned training and follow-up, the anxiety score of patients in the intervention group was determined lower than control group. These results suggest that the positive effect on anxiety state of training and follow-up groups. After follow-up of patient, the trait anxiety score in the intervention group were significantly reduced. After follow-up of patient in the intervention group decreased in a statistically significant level of depression score at the same time. It was determined that a silent increase in the control group. By contrast, this may indicate that intervention is effective in reducing depression. Implantation of a pacemaker is treatment for cardiovascular disease in the first period, but then it can lead to restrict spiritual life and cause psychological stress in patient. The studies that have been reported to be more common than in the general population, depression and anxiety in patients with pacemaker. For example, in Aydemir's study, the results have been found psychiatric diagnosis in percent 19 of patients with pacemaker, like this adjustment disorder and major depressive disorder. The most common symptom in patient activity and work constraints, physical anxiety, energy loss, hypochondriasis, and insomnia. According to another study that was found, pacemaker patients given training by nurses were decreased significantly in the anxiety state. And Dereli also determined in her study that pacemaker program training had reducing effect on anxiety of patients. In many psychoeducational studies in the literature, after training in depressive symptoms, for example, or stress anxiety experience by patients, was found that a reduction by the importance of quality of life, patients prefer quality rather than quantitative in health indicator. Therefore, way of providing a change in behavior which enhance the quality of life of patients with heart disease and compliance can be achieved toward education. In a study, Shans and his college, after 2 months, pacemaker patients' quality of life score in intervention group found higher than in control group. In this study, quality of life subscalas of general health, perception, mental function, physical function, mental health, and pain scores were found to be higher for intervention group. In accordance with the result obtained from our study, as well as evaluation of psychosocial aspect of patients with pacemaker, the presence of consultant reachable via telephone, implantation of planned education, and follow-up programs by nurses are recommended. Yes, thank you.
Any questions?